Agenda 111 at the end of 8 years, Mr. Speaker, there was not one single hospital. I'm not engendering debate. I'm just trying to explain the circumstances. Mr. Speaker, Agenda 111, at the end of 8 years, Mr. Speaker, there was not one single hospital that was operational. Mr. Speaker, in fact, what we came to meet was multiple hospitals littered around the country, some of them at foundation level. There was not one hospital that a human being could walk in. However, they had spent millions and billions of Ghana cedis, to the extent that, Mr. Speaker, the Auditor General surcharged 35 contractors 7.9 million. And the refund that the Auditor General, Service surcharged.
Honorable Deputy Minister, please focus on the major issue.
Thank you, Mr. Speaker. I am guided. Mr. Speaker, the current government is serious about what is happening in our emergency rooms. We have constituted a committee that is looking into it. We are collecting data as to what is actually happening in our emergency rooms. Mr. Speaker, the issue is multifaceted. Is it the pre-hospital, the ambulance, the pre-hospital care, or is it indeed what is happening in our emergency rooms? The ambulance service, Mr. Speaker, we had 30 ambulances that are currently parked. Mr. Speaker, in the last 5 years, the ambulance service personnel have not been recertified. Mr. Speaker, the ambulance was there because of the proximity to the ambulance service. They got there on time and they did what was necessary. Mr. Speaker, the issue of no bed syndrome, unfortunately, is not a new issue. This issue has existed for so long, and unfortunately, we or the previous government was not able to fix it. Mr. Speaker, in this government, we will take a bold step. The John Dramani Mahama government is going to take a bold step to solve the problem of no bed syndrome. Mr. Speaker, we are going to retool the hospitals, starting from the CHIPS compound to the health centers, all the way up to
Majority Leader. Majority Leader.
Mr. Speaker, they requested to make a statement. I knew that this statement will raise issues, but at conclave, you said we should have it. Now, you've made a statement, she's commenting on it, and Mr. Speaker, just imagine the level of noise that is emanating from the other side. So, Mr. Speaker, can you imagine somebody using the word very insensitive?
Honorable members, please, let's listen to each other.
Yes, we need to listen to each other. You may think it is insensitive. You are talking about no bed syndrome. What does no bed mean? It means you didn't construct enough hospitals and provide enough beds. That's what no bed means. That's what no bed means. You may disagree with her, but that's her view. That's her view, that this is the underlying cause of the problem. That the hospitals don't have the beds. They don't have the space. They don't have the capacity. Because you promised and you did not deliver. You may disagree with her, but that's her view. Please, let's listen to each other.
Honorable members.
Thank you, Mr. Speaker.
Please.
We are retooling the hospital.
We agreed that we'll take 3 from each side of the house. So kindly wait when it's your turn then you can put across your views. But honorable members, I thought we agreed on some key issues. You are a Deputy Minister of Health. Do you need a bed to attend to emergency situation?
Thank you, Mr. Speaker. By definition, Mr. Speaker, an ambulance itself is a bed. An ambulance is what we classify as a step-down unit. The cart in the ambulance can be considered a bed. So in such cases, a patient can be treated in the ambulance.
Yes. Even outside the ambulance.
Exactly.
Outside the chair, even at the ward, do you need a bed to attend to?
Mr. Speaker, the patient
so let's move on, please. Let's move on.
Yes, the patient can actually be treated. That is why we have constituted a committee to look into it, and that is why, Mr. Speaker, we are retooling the ambulance service because they need to have the proper equipment in the ambulance, Mr. Speaker. It is not just the bed. Mr. Speaker, it is the bed plus the oxygen plus the IV plus the IV infusion itself plus the monitors plus everything in the ambulance. Mr. Speaker, an ambulance is not just a transportation device. So, Mr. Speaker, we are retooling the ambulances.
Honorable Deputy Minister, I was a Minister for Health. I know what I'm talking about. Please focus on the issue. The reason was that no bed. That is why we've been told.
Speaker.
So focus on that. You've done well by establishing a committee to investigate the issue. So let's look at it seriously.
Thank you, Mr. Speaker. As a ministry, we are taking every step to ensure that such situations never happen in the country. Mr. Speaker, we are retraining our emergency services staff. Mr. Speaker, we are both training the doctors as well as the staff. We are even training the security in the emergency rooms. Mr. Speaker, we are also extending this into the ambulance service itself. We are going to ensure that all the ambulances have the necessary equipment to save precious Ghanaian lives. Mr. Speaker, this patient could have probably been saved if we had the proper supplies in the ambulance. Mr. Speaker, we are working diligently to avoid such needless deaths of any Ghanaian. And in conclusion, Mr. Speaker, I would like to express my heartfelt condolences to the family, and I would also like to express my condolences to the rest of the country. Mr. Speaker, under our government, such incidences would not happen. Thank you.